Universal Communication Form by Aubrey Adams. Have you ever been put on hold while calling physicians to update the office on their patient? It can be timely and frustrating. There needs to be a universal way to communicate basic patient updates. A Universal Communication Form, or UCF, is the answer to this problem. It can be used to fax, email, or sent with an electronic medical record to update the physician when the patient is sent for testing or screenings. It is for offices to communicate basic patient information and to keep track of what information is being shared. The UCF can be quickly sent and saved to the patient's chart faster than attempting to call the office. The details of this innovation will be explained further in this presentation, but please message me with further questions. Electronic medical records, or EMR. How are they used? Advantages and disadvantages. Electronic medical records have changed healthcare in many ways. It has expanded the ways healthcare professionals are able to communicate with each other. The advantage of EMR is that it organizes patient information and makes the information accessible to all facilities that are within that specific health system. The disadvantage is that each health system has their own EMR. In some areas, they still have paper charting. There is no link between all EMR systems, which makes sharing patient information and communication between offices difficult. The missing link. Why is this innovation needed, and what is the importance of communication? A Universal Communication Form, or UCF, is needed to fix the communication barrier between different health systems. When a family physician sends their patient for further testing or screenings, they are under the impression that the patient will go to the things that they have ordered. There needs to be a way to update ordering or referring physicians about their patients. Physicians within the same EMR are able to easily view what the patient is doing. The issue is the offices do not have that specific EMR, or offices that have paper charting are difficult to update on everything their patient is doing. Communication is important because, for example, in the lung screening program that I work in, if a patient does not schedule or show up to their appointment, their family doctor can then follow up at the next visit and encourage the patient to have the screening. Communicating with other physicians encourages thorough patient care and can increase overall patient satisfaction. Research. The research completed regarding this problem did not have anything regarding an actual form that all offices could use, but there was discussion on what they called a cloud, which was for all EMR information and it could be shared throughout. The issue with this is it did not take into account the offices that still have paper charting. In the way of feedback, I did take into consideration what my other classmates advised me to do, or things that they also found issues with communication. I found the virtual classroom to be very helpful with that, where we could throw around different ideas, especially with those of us who had similar topics. For brainstorming, I tried to think of an actual innovation that I could come up with for my job that would be beneficial and that I could make happen. I noted questions that were frequently asked, either from me to the physician or from the referring physician back to me, and I wrote some of those down. The ones that were most frequently asked were the ones that I put on the actual form. UCF can be used by all staff, including physicians, nurses, and patient care assistants. It provides a trail of information explaining what is going on with the patient. This will reduce phone calls, which open the phone lines for actual patient calls. I know one of my own pet peeves as a patient is calling to schedule something or ask a question and having to wait on hold for what seems like an eternity. If healthcare facilities use the UCF form, information can be passed along without having to wait to talk to someone. Usually, when an office is reached, a message has to be sent either electronically or in paper form to the nurse or physician anyway. Why not bypass the phone call and just directly send the message to the nurse or physician? A UCF can be used by all healthcare facilities. Facilities with EMR can upload the form into their system so it can be used electronically with the option to print if needed to send to non-EMR or other EMR areas. It can also be in paper form, which can be faxed or scanned into the computer and emailed. For facilities with EMR, the form is automatically saved in the patient's chart, and for facilities with paper charting, the form can be placed in the chart. The benefit to this is that if information is ever questioned, there is proof that it was communicated between offices. The UCF falls into the quality, efficiency, and outcomes area in the Framework for Innovation. Quality, because this form will increase the quality of care that patients receive by encouraging communication between physicians and offices. Efficiency, because it is cutting down on phone calls, which allows patients to reach the office faster. It also increases patient outcomes because it can alert the referring physician that the patient did not show for their screening, was unable to be reached, or was not interested. Then the referring physician can encourage the patient to have the screening done. The resources needed. I'm in the process of having this form approved. Here are the steps that I have encountered or I am planning on implementing to make this innovation possible. Create an actual form, which I've done, following Lancaster General's Hospital Forms policy. Submit the form to the Forms Committee for approval. Get the form approved and uploaded into Epic. And then email offices or departments that will benefit from the use of the form regarding how to use it. And if you're interested in taking a look at the form that I've come up with, here is the link that will take you to the Universal Communication form.